Okay, so as I was saying, let's get this recorded as well. Um, the way that there's a few different ways that we can collect patient information that we need to accompany their sample before we test it. The primary one, or the one, I guess the preferred method for all parties, is this patient registration portal. And so, have you guys received the box of collection kits and other items that we sent to you a little bit ago?
Yes, I didn't even open it. So
Okay,
it's
don't worry
not
about it.
a
You don't necessarily need to, during the call or whatever.
okay.
But one of the
Mhm.
things that's in there, in addition to the collection kits that I'll go over in a little bit, we sent you some UPS shipping materials. I'll talk about those kind of towards the end of the call.
Okay.
Was a folder, and in that folder there are going to be various. There's various things. There's some marketing materials, some flyers and things like that that you can put up, and a couple of other things. But one of them should be anyway, this patient registration portal instruction sheet
Hmm.
that
Yes.
includes a URL that's right here that is specific to your pharmacy. It's got an access code baked into the end. Patients are probably never going to see that, and a corresponding QR code. So the QR code is mainly for walk-in patients. They're interested in getting tested. You tell them that they need to uh, give the lab their information. They can scan this QR code and use this instruction sheet to kind of go through the process of getting that information entered. As I talk today, I'll probably sprinkle in some things that I have found to be what I would maybe consider to be best practices. I've worked with hundreds and hundreds of pharmacies now over the past few years, and I've kind of gotten a feel for what many of them will do in order to improve their workflow. Because again, we want to be as minimally disruptive to your day-to-day workflow as possible. And I think one of the ways to do that is to essentially give the patients, in as many cases as possible, give them the tools that they need to register themselves in our system, collect and label their own samples, and
Hmm.
kind of go away. Like go out to their car or go off to to an area that you have set aside that maybe they can do this, so that they don't
Yes.
have to stand there at the bench or the register, take up space in line, cough all over everybody, make folks uncomfortable, including themselves. And so what I see a lot of pharmacies do is one of two things. One, they will have photocopies. Some places will just post this instruction sheet somewhere. Maybe they'll laminate it and post it on a bulletin board or something. That's
Hmm.
great, but then the patient is kind of tied to that bulletin board while they go through this process, because there are some brief instructions on the bottom of things that they're going to encounter. I think the better practice is to make photocopies of this, and when a patient comes in to be tested, you hand them a copy of this. You hand them their actual collection kit, which I'll get to, like I said, in a minute, and some instructions we have around that. And again, you
Hmm.
tell them to go somewhere else and at their own pace go through this process, and then they can come back to you with any questions and or to turn in their sample and go home. The other thing that I see folks do is they will take this URL and they'll put it on their own website or their social media, or maybe they'll send an email out to their patients letting them know that this is a service that they're now offering. They won't include the gobbledygook here of the access code. They'll just turn it into a click here. But
Hmm.
a patient can basically pre-register in our system before they ever walk in the store. The only thing they won't be able to do is tell us is to register their actual sample, and I'll get to the difference in a minute. But all their personal information, name, address, phone number, insurance information, etc., that can all be done ahead of time if you give them access to this URL. Totally up to you if you do it or not. I think in most cases folks are walking in for these tests and they're using this QR code. So I'm going to
Okay.
flip over to a live demo of how patients use this portal. But before I do, I want to point out a couple
Hmm.
of things about the difference between the instruction sheet and what you're about to see. So on this sheet, these screenshots are what our portal looks like on a cell phone in portrait mode. So this is a website. It's not an app, but it is optimized for mobile use. So when it's on a phone, it looks like this. When
Hmm.
a patient is on a computer, a laptop, a tablet in landscape mode, the only difference is these little menu items that are at the bottom that are really tough to see here. Instead of being on the
Hmm.
bottom, they're going to be on the side. So that's what you're going to
Okay.
see here in a second when I flip over to it. The other thing is Let me make this a little bit bigger. The first time that a patient logs in, they're going to come to this create an account screen. I'm not going to show you that because mine is already created for my little demo thing here. But instead of just asking them for a username and a password, we're going to ask them for some of the required information that we need anyway, which includes their first and last name, their date of birth, their gender, and then we'll also ask them for their email address and to create a password. So I'm not going to show you that. I just wanted you to make you aware that that's what they'll encounter the first time. And there's some instructions again about what they need to do. So if I flip over to my website here, this is a portal for an internal, this is a version of an internal portal. Yours up here will say You First Pharmacy for anybody that accesses your link or scans your QR code. Anytime that somebody logs in, whether it's the first time or the 10th, they're always going to be taken to this dashboard page, which we consider to be kind of the homepage of the portal. And it's where somebody can get kind of a quick, easy look at what's going on with samples that they have submitted to us or registered with us at any time. And so the first time somebody comes here, this is going to be blank, of course, because they haven't registered anything. But from the second that they do, and I'll get to that in a few minutes when I get to this order test tab, it's going to show up as what we call one of these tiles. And the tile is just a brief, who the sample is for, the ID that we assigned for it, what we're testing, when the patient registered in the system, and a little status button that will update as the sample works its way through the system. When it's first registered, it says that it's in transit, meaning that we haven't received it yet. But when we receive it, we'll scan it a few times as it works its way through our process. That status bubble or button will update in real time. Eventually, when the test has been completed, it will say completed, and there'll be a link for them to access their results. That said, I don't expect anybody to come back into this dashboard or into this portal looking for their results. So I don't want somebody coming in the next day and hitting refresh 1,000 times until this little button turns green or blue or whatever color it is when it's completed and getting their result that way. And that's because when we complete these samples, complete the tests, and the results have been approved by our lab director, if the patient gives us their email address, which we ask them to do right from the beginning, and or their cell phone number, they're going to get an email and a text that says, this is Mobility Health, the results of your test are available, click here. They'll click a link in the text, let's say. They'll be asked to put in their date of birth as a secondary identifier, which is a HIPAA requirement, and their results report will come up. So they're going to get their results passively, and they're not going to have to come back in here to get them. But if they did happen to come back into their portal for a status update, it's going to be, like I said, updated in real time to let them know what's going on. So again, first time they come here, this dashboard will be empty. All they're going to need to do is just work their way through these menu items. The first of which is called My Info. It's exactly what it sounds like. And they just need to fill this out. If the field has an asterisk by it, it's required. If it doesn't, it's not, of course. The required ones, most of them are already going to be filled in when they created their account, first, last name, date of birth, and gender. All they have to fill out then is their address, city, state, and zip. Their email address will be filled in here. And again, we ask them for their cell phone number only because we want to be able to text them their results or the link to their results if they would like. If they don't fill it in, they won't get the text. We ask for but don't require an image of their ID to be uploaded, their state ID, their driver's license, whatever. We don't require it because we know not everybody happens to carry it on them at all times. But if they have it, I would tell them that they need to upload it. We use that to verify the information they gave us up here. In my example, if John Doe was really Jonathan Doe or Michael Jonathan Doe, we would change that based on the ID because that's what the insurance company is going to know this person as well. We also do the same thing with date of birth. Sometimes we have people who aren't from the US who will use the day, month, year format. And so somebody that was born on February 3rd is going to put down March 2nd, and the insurance company doesn't have a patient that exists with that name and date of birth. So if we get that ID, it's really, really helpful. The next thing we need is their insurance information. And so when they get to the point that they're ordering their test, there's going to be a few things that the system here checks for before it basically allows them to complete that order or registration. And one of those is that they need to have filled in the name of their insurance company and their primary policy number or member ID. They're free to fill out this other information if they want, but we're not going to check that they've done so. But if they haven't put something in here for the payer name and policy number fields, and they go to register their sample, they're going to be prompted to pay for that test by credit card because the system is going to assume that they don't have health insurance or that they don't want us to bill it to them. And so that can be done right here through the portal. I'm actually going to leave this payer name field blank to show you how that works in a minute. We charge $99 for the test. They would do that right here. You wouldn't need to be part of that transaction. We would still pay you guys the $20 per sample collection fee like we do on a quote unquote normal sample that bills to insurance. But again, they would have to do that. So again, these two fields need to be filled out. The way that we prefer for them to do this, and it's mentioned in the instruction sheet, is rather than just typing in the name of their insurance company, we have a database that has a bunch of them already in it, and we would rather that they search for those because sometimes if somebody has who's a common health insurance carrier in your area?
We got Aetna.
Aetna. So, okay. So if Aetna is one, they can type it in here and there's a whole bunch of selections. This common one is probably what most of your patients are going to use. These other ones are very likely state Medicaid accounts, but say they use that one. And that's great. They can select it. It'll fill in the name of the payer. Behind the curtains, it's also telling us some other information that we'd like to know about that company. But if they didn't do that, and they came in here and they decided to type Aetna, shoot, I have to refresh here. And they spell it wrong, then we're not going to know who that is. And then we have to do some, they do this. Then we have to go in and kind of make some changes. So we like for them to start with that search bar. If they search for something and they have Mickey Mouse Insurance and that doesn't exist, then they can come down in here and put in the name of that Mickey Mouse carrier. Does that make sense? Okay, so I'm going to leave that blank because I just want to show you what happens there in a minute. Same thing with insurance cards. We really, if they have their health insurance card on them, which they probably will if they're able to figure out, or if they know what their policy number and member ID are, we want them to upload an image of the front and the back. The front, for obvious reasons, lets us verify that this number they put in is correct. The back of the card will have the contact information of the office of that carrier that happens to manage this particular policy. So Aetna is a gigantic company, offices all over the country, very unlikely that the office that manages your patient's Aetna policies are in Charlotte. They're probably in like Santa Fe or Denver or something. And so knowing that with the back of the card is really helpful. We can figure it out otherwise, but if we have a problem with a claim, we'd love to just have all the information handy that we need to work it out without having to try to get back in touch with the patient. So again, upload an image of the card. They can put in secondary insurance if they have that as well. An example of where secondary insurance can also be useful is if a mother comes in with her daughter, let's say, and mom is covered under her employer's insurance and the daughter is covered under dad's or ex-husband dad's insurance. There's a way that I'll show you in a second that mom can enter her own sample, register her own sample and that of her dependents in the same, under the same portal account. But, and then what we would have is when we go to verify insurance coverage, we would see mom's sample, we would look for this policy, see that she's covered by it, move on to the daughter's sample, check this policy, see that the daughter is not covered by that one, and then immediately move down here and know that this is the one that the daughter is covered by. Okay. So anyway, they fill out all those fields. I won't spend a lot more time on that. Save their changes, and now we have a patient profile built. All of this can be done before they ever walk in the pharmacy. So again, if you give them that link as opposed to the QR code, like if somebody calls in and says, I'm interested in getting tested, I heard you offer a COVID flu test, maybe you could email them the link to get here and tell them to completely fill out the My Info page. And then they can come in and they've kind of completed this part of the process. And all they need to do from that point on is register their actual collection kit. So everything on this My Info page probably isn't going to change very often, right? None of this stuff up here is likely to change Their billing information may change once a year or something like that, but everything on this order test page is going to be specific to the day that they're coming in to be tested. And so this is what they'll do when you hand them their collection kit. So the first thing we're going to ask them is which test it is that they want us to run. Right now, the only test you'll see is our COVID and flu test. As we add others to your menu, and we'll talk about that either at the end of this call or at another time, depending on where we're at time wise. There'll be other menu items that are added. So whichever test it is, it's going to be COVID flu for this program we're talking about now. They'll click that test, that little bubble is going to turn orange, and then it's going to ask them the questions that establish that medical necessity. And as you know, medical necessity for a COVID or COVID flu test are symptoms or suspected exposure to somebody else that's sick. And so we asked them a couple of questions to establish that. One, have you had close contact recently with anybody that's tested positive for the flu? I'll say no. Same question in the past couple of weeks, have you been around anybody that's tested positive or had symptoms that are consistent with COVID? I'll say no. Regardless of the answers to those questions, do you have any symptoms? So I'll say this patient has a few different symptoms. If the patient says no to both of these questions and that they don't have symptoms, and they will be forced, like if they go to the bottom of the screen and they don't choose any of these boxes around symptoms, they will be prompted to do so. They need to tell us yes or no, do they have symptoms? But if they answer no to both exposure questions and tell us they don't have any symptoms, again, that's going to show that medical necessity has not been established, and we're going to prompt them for that credit card payment. If they make a mistake, they can always hit cancel, go back, and they forgot to put in their symptoms or something, they can do that. And then again, I told you before that we can use this portal to register multiple family members under the same account. So if I say, who is this test for? And the first one is for mom in that example, and she's told us her symptoms up here. The next thing we're going to ask her for is her specimen barcode number. And so what you're going to see when you open that box of collection kits, that a collection kit is comprised of a nasal swab, a little tube or vial that the swab goes into after the patient has collected their sample, and then what's called a biohazard bag, which is a fancy word for a Ziploc, that collected sample inside the tube is going to go into and get sealed. The other thing that's in there is you're going to see a strip of really small QR code stickers or labels. The QR codes themselves are about 1 centimeter by 1 centimeter. So the stickers are just slightly bigger than that. One of those stickers is going to go with each collection kit and ultimately is going to get stuck on the side of that collection tube. Those little QR code stickers have a series of letters and numbers below them that we want the patient, to type into this specimen barcode field. They always start with the letters MH for Mobility Health, and then they're followed by exactly 8 digits. 1, 2, 3, 4, 5, 6, 7, 8. There's a format checker on this. So if the patient doesn't put the MH or doesn't put all 8 digits, they'll get prompted to do so. I'll leave this at 7 digits just to show you what that looks like. So anyway, so mom takes her collection kit that you hand her, and she puts in the barcode from that kit. These next fields are going to fill out, or they're going to auto-populate, basically. The client name for your login is going to say You First Pharmacy. The collected by field is going to say self. This is an approved self-collected sample, so that can just be left alone. Even if you help a patient or mom helps her daughter collect her sample, you don't need to change it. You can if you want, but it really doesn't matter. So we just leave it as self. Same thing with date and time of collection. It'll auto-populate to the current date and time or whatever time that order test link was clicked. If the times are grossly different for some oddball reason, these times can be changed. You can click in here and change this to 8 o'clock, or you can click this little calendar icon and change it to whatever. But in most cases, it's going to be pretty close, and close is good enough. If the patient has any notes that they want to include, I don't know what they would be, but we do have a field here where they can tell us something that maybe wasn't covered before. Whoops. And then the same thing is true if they have other things that they want to send us. Sometimes we see like return to work forms or return to school forms or something like that. If they want to upload an image or take a picture of it and include it, we'll fill it out and email it back to them. We don't, like I said, we don't see it very often, but if they need us to, they can. Their consent statement is built in. They can read it. It basically just gives us their permission to run their sample, share their results with you, because we're covered by a BAA to share HIPAA compliant information. Couple of other things that are in there. The only one I guess maybe worth mentioning is if we use their sample for R&D purposes, and we published any results, we would de-identify those. So it wouldn't say that this is Mary Smith's sample. It would say it's a 35-year-old female or something like that.
Okay.
So anyway, once they're done with that, they hit create order. And as long as they didn't make any errors, they're going to be fine. But I made a couple on purpose just to show you. So the first one is it's saying that a payment is required because in order to qualify for health insurance, you must have entered your insurance company carrier name and your member ID. If you remember, I didn't do that. If that wasn't a mistake and they click pay for testing, they would come to a credit card interface where they could, put in all their information and fill that out. So I didn't do that. So if I made a mistake, I didn't enter my carrier name, I can hit cancel. I can go back here. I can put in the name of that payer, save it. I kind of have to start the process over again with the test, but that's a pretty quick thing. No, and sneezing. Let's say for this one, put my barcode back in, and now I should be good to go, but I have an invalid barcode format because I didn't put all 8 digits. So again, if I put that in, I hit set create order. Now it's going to go through. I'm going to be redirected back to my dashboard. And that test that I just registered is going to show up as the first tile on the list. So we try to make this as dummy proof as we can. If people make errors, it's going to tell them that they've done so that if they get back to this screen, this dashboard screen, they've done everything they need to do. If they don't get back there, there's other things they need to fix. Hopefully you can help them out if they can't figure it out. But in most cases, I can't think of any actually where folks haven't been able to figure this out. So any questions around how a patient uses the patient portal?
No, not at all.
Okay, all right. So we realize also, though, that there are going to be patients that can't or won't use the patient portal. Maybe they don't have a smartphone, or they're not tech savvy, or they're compromised in some way. We want to have options for them as well. We do have a paper requisition form. I'm going to show you where that is in just a couple of minutes, where you can access it. But if there's just no other recourse, the patient can't use the patient portal, you're not able to use what's called our provider portal, which I'm going to show you next. You're free to print one of those things out, hand it to the patient with a clipboard, tell them to fill it out. And just make sure if they do that, when they bring it back, it's legible and filled out completely. As long as it is, you can put it in the bag with the sample that you send us, and we'll type it in for them. It's not ideal because we don't have a way to question anything that comes up on it from the patient if they left something out or whatever. The patient portal is our preferred method. If, again, people can't or won't use that, we have this provider facing portal as well. I probably got logged out of it. So no, I didn't. Okay. Have you been on this yet? We sent you an email a little bit back where we sent you a link to access this. Have you done that yet?
No, not yet. Can you send it, because I get so many emails? Yeah.
What email address? Here, let me take a look. I'll tell you which one I'm going to take you kind of behind the curtains here.
Okay.
So we use the UFirst Pharmacy at Yahoo? Okay.
Yeah.
Oops. Okay, so you'll get an email in a minute or so from there where you can create a password and set it up. But after that, once you've done that, this is going to be your provider portal site, portal.mobilityhealthlab.com. Once you get there, I would bookmark it just so you've always got it. And then I'm not going to spend a terrible amount of time on this because a lot of what you've seen already is with the patient portal, it's going to look similar. But let me point out at least a few things that are that are a little bit different. First of all, again, like the patient portal, anytime that you log in, you're going to come to the homepage, which we call the dashboard, which similarly is meant to give you a quick look at what's going on with samples that you have registered, or your patients have registered and submitted to us recently. And so instead of those tiles, we have a couple of different tables. One is called active orders. A test is an order in our world, and the other is completed orders. A test is considered active until it's complete. So that test that I just registered a couple of minutes ago, right here, shows up at the top of my active orders table as a pending. And unfortunately, the headers of these two columns are backwards. But this is the status. This is the name of the test. So it's showing as pending, meaning the lab is waiting to receive it. Once we receive it, we do some pre-work on it to make sure that we have all the information we need to process it. We scan it in, and the status changes to logged. And then once it physically moves into the lab and a lab tech starts testing it, they'll scan it again and it will change to active, meaning it's inside the lab being tested. And then after that, the test gets complete. The result gets approved by our lab director. The test gets marked complete, and it moves from this active orders table over to the completed orders, where you'll see the name of the patient, the ID number for their sample, but most importantly, under this report column, there'll be a link to view their results report. So if a patient, for whatever reason, says they didn't get their result report, which could be they gave us a bad email address, or it went to their junk folder and they didn't realize it, or they didn't have a cell phone that they gave us, they can always contact you and you can tell them their results. Similarly, if they're positive for something and they need to know what to do, say they tested positive for COVID, you can pull up their report, print it as a PDF, fax it, email it to their doctor to make sure that you get that Paxlovid script, if that's what's called for, and it doesn't go to, say, the Walgreens down the street. So I might as well show you now what a results report looks like. This is a report from a test that I submitted about 3 months ago. Pretty similar probably to what you've seen in the past. Basic patient information, the test that we ran, when the sample was collected, when we received it at the lab, and when we reported the results, along with the individual results of the each of the pathogens that we're looking for. So this test we're running now is a COVID, flu, RSV. You'll see a result for COVID, flu A, and flu B. And then what's on the rest of the report is basically mumbo jumbo that we're required to put in there by either the CDC or FDA. A really exhaustive explanation of the test and how we validated it and its accuracy, an explanation of what the results mean. That's not really difficult with a test like this, where you're either positive or negative. But there's other tests we run that it requires some interpretation, and that would be listed here. There's some links to some FDA required fact sheets that the manufacturers of the tests put out, so they can click those and see those things. Again, nothing too terribly interesting at the bottom of the report, but the important stuff is up above.
So we submit it to your insurance, and so, yep, and the insurance paid your Express Scripts.
Oh, sorry. I thought he was asking me a question.
No.
Gotcha.
No
Okay.
question.
Okay. All right. So that's the dashboard page. Again, quick look. So you send us samples the next day, maybe, we receive the samples about 10:30 a.m. Everything ships to us next day air by UPS. If a patient calls at 12 o'clock, 1 o'clock, something like that, and they're wondering what's going on with their sample, they're anxious to get their result, you can come here to the dashboard page and you can see the status of their report or of their test. If it says active, it means we're actively testing it. It won't be long until they get the result. If it still says pending, that means we probably haven't received it yet, meaning that either there's a problem with it that we've already reached out to you to look into, or we haven't received it. Maybe you didn't ship it, or UPS had a delay or something like that. If the delays by UPS are significant, they're going to be more than a couple hours, let's say, we'll contact you and let you know. Snowstorms happen, things like that. It is what it is. But anyway, you're able to easily on this dashboard page tell a patient what's going on. So there's other things with this provider portal. I'm going to skip over new order and close with that, but you'll see here it says that completed orders are on this dashboard page for 3 days. That's the most likely time frame in which we think a patient might call you with questions or needing you to help them get a prescription for whatever their whatever their results were. After 3 days, it will drop off of here just because we don't want you to have to scroll and scroll and scroll to find a patient's result. That said, once it drops off of here, it doesn't mean that it's gone. This lab orders tab is going to have every test that you've ever sent us since the beginning of time. And so as as time goes on, hopefully that builds. And there's a search button. So if I search my last name, this is going to show you every test that I and my family have submitted to us over the past couple years since we implemented this system. I've got about 77. You can change the number of entries that are shown, etc. Pretty user friendly. If the test was completed, you can view the results still. So again, if somebody has a question about something, you've always got access to it. Same thing is true of patients. So once a patient is in here once, they're in here for life. So where this can be useful is if this Sarah Adams is your patient and she moves, or we call you and say, hey, it looks like Sarah uploaded an image of her prescription insurance card and not her health insurance card. Rather than getting Sarah super involved with going back into her patient portal, you can just help her out and click on her, edit her profile, change her address, or come down here and give us the image of the proper insurance card. If you're not able to do images when you send in reports, or the patients can't, like their cell phone camera is broken or something, photocopies work as well. So if you just want to make copies, fold them up, put them in the bag with the sample, that works great too. But anyway, once a patient is in there, they're in there and you can edit them. I'll show you where that's really useful in a minute as well. There's a tab here called reports. I'm not going to spend any time on it because yours is going to be empty, but we will be adding some reporting capabilities for you. One that I know we will add will be a sample count report. So if you're wondering how many samples we've submitted to the lab in the month of November for whatever reason, you'll be able to click that, put in a date range, 11/1 to 11/30, hit run, and it'll spit out a spreadsheet, either an Excel file or a CSV, show you everything that you've submitted to us and we've processed. There's also a resources tab. What this has is yours will, the files here will be a little bit different for yours than some of the ones I have listed here. But everything that we think could be of use to you, instead of making you have a folder or a binder or something with everything related to us, we put it on here electronically. So that patient portal instruction form with the QR code in the corner will be in here, as will the native file of the QR code itself. So again, going back to best practices, what I see a lot of pharmacies do is they will take this QR code, JPEG or PNG, photo file, and they'll blow it up maybe to the size of an 8.5 by 11 sheet of paper, and they'll put it on their front door or their drive-through window or something like that. So patients, when they pull up, they can scan the QR code from their parking lot, get started with the registration process while you bring their collection kit out to them. And that way you keep them out of the pharmacy altogether. So that they're comfortable in their car. And again, they're not maybe making you or your staff uncomfortable by coughing all over the place. That paper form I talked about that can be printed and the patient can fill out to register their sample, that will be in there. Our nasal swab instructions, how we want samples collected and labeled, which I'm going to go over right at the end of the call here in a few minutes. That will be in there. The marketing materials that we sent you pretty glossy, high-res versions of those, but we have PDFs of them in here so that if you want to email them to patients, drop them on your website. There's one that's geared towards professionals, meaning doctors. So I see a lot of pharmacies that will send this to their doctors. There's also going to be in your resources tab just a template for an email that you can send doctors to let them know that this is a test that they offer, so that if they have sick patients that come in and they're used to sending them to some other lab for a COVID test and another sample for a flu test, you can let them know that you have one that does both and that the patient can come over here and get it taken care of that way. And there's a few other things that I won't go over. So anything that will appear up here under files are going to be specific to you as You First Pharmacy or specific to you as a pharmacy. We have other types of users that use this provider portal. We have doctors' offices, long-term care facilities, drug treatment facilities, things like that. And so some of the things that apply to a pharmacy will not apply to them and vice versa. But anything that appears as a shared file is what I consider to be agnostic. Everybody who uses this it has the same, it's applicable to them regardless of who they are. The two things that are in there right now, one is called a provider portal instruction sheet or manual. This is basically everything you would want to know about using this provider portal. So you guys are going to have the recording of this call here, but you also will have a really exhaustive manual, and I'll show you what it looks like real briefly right here. It starts from when you create your account with screenshots built in, and then I told you about your dashboard page and how it's used, etc. We're going to go over how to do an order, how to register a sample. It goes field by field with screenshots again included of everything that you would encounter, what's required, what's not. It even goes into like error messages that you might encounter and what to do about them, etc. So everything you should want to know about this is going to be in that instruction sheet so that it can be used as a refresher for you or as a training guide for anybody else, a farm tech or anybody else that you might want using this system. And then the last thing that's on there, or the other thing that's on there, is a supply order form. So when you get going, of course, you're going to start going through supplies. We sent you about 25 collection kits and some UPS shipping materials and things like that. But you're going to run through them. And so we used to have folks call us or email us or text me to get replacement collection kits and things like that. And it just became untenable at some point. So now we have this order form. I don't know if I have a copy of it open already. I don't. So I'll open it. It's a PDF will come up. It's got a QR code on it. I love QR codes. So you can scan that and it'll take you right to an online form, or if you're doing it on a computer, this is the form itself. You can click it, open up the link, and it's just an online jot form. You can tell us who you are, where you want it shipped, whether you want this stuff shipped to your house or to the pharmacy, doesn't matter to us. And then you can tell us, I need 25 more collection kits, and I need some more UPS supplies, and I really like that poster you sent me. Give me another one of those. And you can submit that form and we'll fulfill it usually the next day. Okay?
Thank you.
All right, so that's kind of the resources tab. So let me show you the other way that you can register patients and their samples on their behalf if they can't do it through the patient portal. It starts on this new order page. It's going to look really similar to what I already showed you. It'll start with that barcode number, the MH number. It's got the same format checker on it. So if you get to the bottom of this screen and you try to enter it, it'll prompt you if you made a mistake. This stuff is auto-populated. You'll click which test you want us to run, fill in the patient's information, the same required information as before, upload or give us a photocopy again of their ID. We're going to ask you to tell us what their billing method is. Again, we have other users of this portal. For you guys, 99 probably +% are going to be patient insurance, whether that's commercial insurance, private insurance, Medicare, Medicaid of North Carolina. It's all patient insurance. So you'll select that. If a patient doesn't have insurance, we really, really would like you to push them to use the patient portal because it has that credit card interface on it. We don't have that built in here because we really just don't want you guys bothering with having to get credit card information for this kind of thing. If at the end of the day, they can't do that, like they don't have a phone or you're not able to use somebody else's to give them access to their patient portal, you can mark no insurance, but we won't run their test until we have reached out to that patient and gotten that credit card information. So they just need to know that they're going to be getting a call from us, because a lot of times patients don't answer the phone when we call because they don't know who we are. So that's why we prefer the patient portal. There's some employers where they prepay us for employee testing, especially self-insured employers that don't want those claims going on their insurance. And we have some long-term care facilities, and we have some pharmacies that deal with long-term care facilities. Actually, they'll go there and they will provide testing, the sample collection services for the long-term care facility. However, if say the nursing home has patients that are covered by Medicare Part A, Part A is a little bit different in that we would bill the facility directly, and then the facility in turn bills Medicare. They actually pull the payment from a stipend they get for that patient for their care. If that's the case, if you have long-term care facilities you deal with and they have Part A patients, that's perfectly fine. You would just need to get me in contact with that facility so that I can get an agreement in place with them and get listed as an approved provider with Medicare for them. That's a process they have to do so that those claims will get covered when they submit them. So anyway, that can be done. But again, the vast majority, it's going to be patient insurance. So you select that. It's going to ask you for primary and or secondary. If it's primary, same thing. Search for the payer, put in again, same check. It's going to ask you for the name of the payer and the policy number. If those aren't included, you'll get an error message telling you that you need to do it. Same thing as before, an image or a photocopy of their insurance card. The patient consent statement is here. If you want to let them read that, that's fine. Then we ask you who the ordering healthcare provider is. That's you. So I didn't look at your enrollment, but if you gave us more than one pharmacist with an NPI number, they're going to be listed here. But if you just gave us yours, that's fine. It honestly doesn't matter. Just select one, because all the insurance company wants to know is that somebody with an NPI number that is approved to order this test, which any pharmacist is, and is associated with your pharmacy, they're fine. It doesn't matter which one. So you'll select one of those. Requisitioner field doesn't apply to you, so don't worry about that. And then the last step is we need to establish that medical necessity again. So on the patient portal, we had all those check boxes with symptoms. Again, this system was designed, this provider portal was designed originally for doctors' offices, and they have folks that are used to dealing with medical billing and billing codes and things like that. And so we've kind of left that alone. The insurance speak for symptoms is an ICD-10 code. We do not expect you, I don't expect you to know the ICD-10 code for a cough, but I'm hoping that if you click in the search field, you know how to spell cough. And so if you put that in, the selection for cough will come up, or the code. You can click that. It'll show up as a little blue bubble. At the bottom of the screen, when you go to create this order or register this test, if you don't have a blue bubble, that's one of the things that it will check, and it will prompt you to do it. So I know it can be easy to skip past this. If you do so, it'll tell you that you did. But if the patient has a fever, put whatever it might be. If they're in close contact with somebody, they suspect that they've been in close contact, you can type in contact or exposure or suspected or any of those things. So if you put in contact, two choices are going to come up. One is contact with somebody with COVID. That was the second of those two yes/no questions on the patient portal. And the other one is suspected exposure to someone with other viral communicable diseases, which in this case would just be the flu. So if they said that they've been the daughter's classmate that she sits right next to in biology class has COVID, and you put in this and you select the one for flu by mistake, you can come over here, you can arrow over that mistakenly entered one, click it again, make it go away, come back in here, put in contact again, and select the right one. Okay, so again, trying to be user friendly. And then the only other thing you have to do is just click yes, that you are a licensed medical professional authorized to order this testing. So if you do that and hit create order, it'll go through. This one won't, because I haven't put in a patient's information yet. And I did that on purpose because I wanted to show you again, once a patient is in here, they're in here. So if a patient registered their personal information at home and then came in and said they wanted to get their collection kit or their sample registered, you could do that for them, again, if they don't want to, or you can start from the beginning with a brand new patient, or if a patient comes back a few weeks later after being tested and they get sick again or something like that, you can use this search box to query them. So again, if I put in my last name, if I can spell it, There's me, there's my daughter, there's a fake me, that's my wife, those are my boys, a bunch of other fake me's. But anyway, if I select myself, all my information that I put in comes up, including my insurance information, et cetera, et cetera. So that's pretty easy. I'm going to take these away real quickly because I do want to show you that error message that comes up if either you don't put in the name of the insurance company or the member ID, or you skip over this symptoms thing. If I hit create order, I'm going to get an error message, and it's going to tell you why. And again, it says when insurance is selected, we selected patient insurance here, you must supply either at least one ICD-10 code. So I took those out, and the name of the payer and the patient ID. So I can come back in here and put the patient's symptoms. We need at least one of those blue bubbles or ICD-10 codes in order for it to pass that check that it goes through. That said, try to avoid taking the path of least resistance. If a patient comes in and it's Susie hypochondriac and she's got everything under the sun. She's got a fever and she's got a headache and whatever else it might be. She's congested. Put them all in because one, we want to be as accurate as possible, but two, between the time that any samples get registered in either of these portals and we actually receive them at the lab, we're going to do a few things. One is we're going to look at the patient insurance information that was entered, the policy number, the payer name, and we have a few databases or services that we subscribe to where we're going to do an eligibility check, and we're going to make sure that this policy is really a health insurance policy from that payer that covers the patient with this name and this date of birth, and that we want to make sure it's not expired, and we want to make sure that they didn't give us their prescription insurance information. As long as it passes that, we're good to go. If it doesn't, again, that gives us time to reach out to you before we start testing the sample and seeing if you can get with the patient and get that missing information. We're still going to run their sample, at least the first time we receive a sample from that patient, because patient care is always going to be first and foremost. You know your patients. We're pretty confident that if there's missing information or they gave us a policy that's expired and they just didn't realize, you're going to be able to help us figure that out. So we're going to run their sample. Now, if we run it and we never get that information and that patient comes back again to be tested sometime later, we won't run that second sample until we've definitely verified that we have the information. But we'll do that kind of pre-eligibility check. It's not a pre-authorization. It's just, do we have a good shot in our mind, because we have accurate information, that we're going to get reimbursed for that claim? Because again, if it passes that and we submit that claim, we're not going to charge the patient anything. Even if that claim gets denied for some reason, we're not going to come back to the patient if they've passed that eligibility check and say that we need them to pay something. Again, the next time around, if we saw that it was declined the first time, we would make the patient aware of that, and then they could make a decision thereafter on whether they want to pay for that next test or give us an alternate form of insurance. So anyway, we do that. The other thing that we do before we receive the samples is we do a little bit of triage, where we will look for and kind of flag samples that look like they're critical. So if I see somebody with 5 or 6 symptoms, especially if they're 85 years old, that's bad. Like that's a potentially critical case. And so we're going to move that sample to the top of the heap. Everything we receive gets resulted out within like 4 or 5 hours every day. But that 85-year-old with all the symptoms in the world, we're going to make sure that her sample goes in the first batch of samples that we run, so that maybe her results come out a few hours earlier than the 26-year-old with suspected exposure who doesn't have any symptoms. Still important to get that person the results, but a little bit more important probably to get the critical patients. So we'll do that triage too. So just be as accurate as you can with this. But anyway, once all that's done, you hit create order. It'll go through. It's going to redirect you. Again, if you get redirected, you've done everything correctly. It's going to take you back to your lab orders page. It's going to be the first test listed on there. It's also going to be the first active order on your dashboard page. Okay. So that's how you register somebody on your provider portal. Any questions about that?
No.
Okay.
Thank you.
Again, it's all covered in that provider portal instruction sheet that you'll have access to once you've gotten into your your portal that first time. All right, last thing I want to show you. So we have a patient's sample registered one way or another. We need to get it collected, of course. So I know you've done this before, but I want to just point out a couple of things. You got a hard copy of this in the folder that will be in that box that we sent you. I also showed you under the resources tab, there's a PDF version of this. I would make copies of this. And again, hand this. Sorry, man, that got big. Hand this, a copy of this, a copy of this, and their actual collection kit to every patient. And they have everything they need to do everything on their own and let you go about your other work. But anyway, a collection kit has a nasal swab in sterile packaging. They're going to take it out of there. We don't want them to touch the swab tip. We want it to just touch the handle so they don't contaminate anything. They can tilt their head back or not. But when it comes to collecting their sample, we want them to, this is not a brain swab, but it's also not something where they just want to pick their nose with the swab. They need to go in about a 1/2 inch, 3/4 of an inch, something like that, and move the swab around. And do that for about 10 to 15 seconds to really get a good representative sample from inside their nose. We tell little kids, I do these clinics at pediatricians' offices, I tell them to put the swab in about as far as their finger will fit, and then sing happy birthday to themselves while they move the swab around in their nostril. That takes about 10 seconds. The other thing that we want them to do is we want them to use the same swab to do that in their right nostril and their left nostril. So that way we know we're getting a good sample, a good amount of sample, enough human RNA to actually run the test. But also these pathogens can live in one nostril, or nares, which is the technical term, and not the other. So we want to make sure that we're catching whatever they might have by getting samples from both sides. Then they're going to take the swab out of their nose. They're going to take the cap off the tube. They'll put the swab tip down into the tube. And then the tubes themselves are about 2.5 inches long or tall, and the swab handles might be 5 or 6 inches. They don't fit, but there is a little notch about 2 inches up on the swab handle. If the patient just bends that back and forth, it'll break right off, and what's left will fit inside the tube. So they'll put the cap on the tube good and tight. And then I'm going to make this last part a little bit bigger. We need to label the tube, and it actually gets labeled twice. You'll see that the tubes already have a white label with 2 lines on them. On that label, they're black, not red like it shows here, but we want the patient or somebody on their behalf to handwrite the patient's first and last name, and date of birth on those 2. I don't know why that's not selecting, but right there. Put their first and last name and date of birth on those 2 lines. And then they also want to take that QR code label that you handed them, the one that starts with the MH, somewhere else on the tube, on the side of the tube, not on the cap. But we also want to make sure that they don't put it on top of what they hand wrote, of course. The reason for the handwritten label is that that's a federal requirement that every sample that gets turned into any lab anywhere in the country, that sample has to be easily identifiable by anybody that happens to handle it, whether they're trained to do so or not. So a QR code doesn't do that. The handwritten label with the name and date of birth does. So 2 labels. Then they're going to put the sample in the bag, seal the bag, and they're good. If there's any paper that gets sent to us, you make photocopies of their IDs or insurance cards. They can get folded up and put in the bag as well, but we don't want them going in that sealed part of the bag. These bags actually have 2 compartments, the sealed part, and then there's a little sleeve or a pocket on the outside of the bag. If you move it around in your fingers, you'll see it kind of magically appear. Just fold up any paperwork and put it in there. We don't want any paper to go inside the sealed part of the bag, because then we have to treat that piece of paper as if it's contaminated, which just means, a little bit of a hassle on our end. So sample on the inside of the sealed part, paperwork in the sleeve on the outside, or it can just be thrown in the UPS packaging, and that's it. And we'll figure it out. So after any samples have been collected and registered, the patient is free to go home. What I would do from that best practices standpoint, again, is when the patient comes back to you and they say, I'm all done, and they turn in their sample, do a quick check. These bags are clear. Do a quick check. Do we have a label with a name and date of birth and a QR code label on it? Does the cap appear to be tight? And is the bag sealed? If that's good, they're good. The other thing I would recommend that you do is if they used the patient portal to register, take a quick look on your dashboard page, refresh your dashboard page, take a look at it and make sure that that patient sample shows up as an active order. That way you know that they completed the process on their end. And then if it passes those checks, they can leave. So, all told, you're probably talking about 2 to 3 minutes with each patient. If you hand them what they need up front and tell them to go do their thing, and then just do that quick verification that they did things correctly when they bring it back, shouldn't be very disruptive or time consuming on your part. And then the very last thing, and I'm not going to cover this in great detail because I am going to have our logistics supervisor, his name is Andrew. He was supposed to join us on this call, but he's sick, so he couldn't. I'm going to have him give you a call and he'll go over our UPS related things. But basically, we sent you UPS packaging, either boxes or I think now we've switched to these. Yeah, when we switch to these UPS packs, they're basically those plastic envelopes that we get Amazon packages in now. There's some of those in there and those pre-printed labels. Anytime you get any samples submitted, whether it's 1 that day or 50, it doesn't matter. Put them all in one of those bags or boxes, slap a label on it, and then at the end of the day, you can seal it. And the main thing that he's going to go through with you is he's going to get you set up as what's called with something called a UPS pickup point placard. You're going to find in the folder that's inside your box that there is this thing called a UPS placard, pickup point placard. I call it Uber for UPS. That's the pickup point placard is a mouthful. It's in there, but it's not activated. He's going to walk you through the steps that you need to take to get it activated so that once it is, and you have a package to ship to us, instead of having to go drop it off somewhere, you'll be able to scan the QR code that's on that placard, and that will notify, I think you'll say, like, confirm that you need a pickup, but all your information will already be in there, including what your pickup time window is. And that'll send a UPS driver in there. It's typically right before the end of the day. Gastonia is a well-populated area. There's plenty of UPS trucks on the road. They're going to add you to their route. And probably within an hour of you closing each day, that driver would show up, pick up the package and ship it to us so that you don't have to worry about getting it somewhere. So he'll call you and get you set up with that. Okay.
Okay.
This past Wednesday?
I know it was a lot. I hope it's I know it's easier. We kind of rush through things here. What I would recommend is if you're feeling good about it but still want to make sure, is I always recommend do it if you want. If you don't, obviously that's fine as well. Collect your own sample, register it in the patient portal, register a staff members in the provider portal. Put your insurance information, let us bill it. You're not going to pay anything for it. You'll get paid the $20 collection fee, which isn't a bad thing as well. But anyway, it gets you used to using the systems before, you're doing it with patients. I think it's always helpful. The other thing is when we see samples coming from a new pharmacy in our world, we will kind of take an extra critical look at those samples and the registrations just to make sure that we're collectively getting off to a good start. And if we see opportunities for improvement, I can reach out to you and say, hey, maybe next time this might work a little better or whatever. Okay?
Okay.
So do it if you want. And if not, I totally understand that as well. But anyway, I want to let you go. We're at an hour. And again, I want to be respectful of your time. But do you have any other questions?
No, not at all. Thank you so much.
Okay. Thank you as well. I look forward to working with you.
All right. Bye-bye.
All right. Thank you. Bye-bye.